My name is Michael Kimerling. I am the chair of the Scientific Coordinating Committee for the International Union, which has the primary responsibility for organizing this conference. The conference really, for me, is one of the most significant activities of the Union because it's the one activity of the Union that brings its memberships together, its members and the membership together to discuss and exchange ideas and to network and to build new alliances. So the conference really is a member-driven conference, and it's the ideas for sessions and abstracts are coming from the members. So that's very important because here you really have people who represent the countries. And this is where we have South-South, North-South collaboration, and we talk beyond the North. So I would say that it's really the issue of prevention. You know, the whole debate about treatment versus prevention. And while there's been a huge amount of activity in the last year regarding MDR-TB, scale-up treatment, the conversation has been tilted to the treatment side, and there hasn't quite been the discussion or adequate discussion on the prevention side. And so prevention, of course, means what's generating MDR, so that's weaknesses in the system, and parts of that system, of course, are FDCs. So we all know if you don't take your drugs, that leads to resistance. We also know that patients don't like to take lots of pills at a given time, but its importance is I think has sort of been forgotten why we started to use FDCs. And the main reason we want to use FDCs is because we want patient convenience, with the idea that patient convenience leads to better adherence. Four-drug FDCs are being utilized by more and more countries, but as a proportion of the total TB population getting FDCs, it's first of all very unclear what that proportion is, and secondly, there are some key countries not yet implementing FDCs. Sort of as a third leg of the issue of access to FDCs and guaranteeing that there are no ruptures in the drug supply system, I think another critical issue is that patient advocates and patients are not even aware of the advantage of FDCs, or if aware of it, or not voicing the importance of access to first-line drugs in good quality, or quality assured, or quality assured first-line drugs. So for me, another issue, some chatter on the side again, I'd say is the question of why are the activists, why are the community not more engaged on the prevention side of MDR-TB? And while many are engaged in the infection control aspect of prevention, I think many people have dropped the ball on the drug quality first-line drugs, and specifically the issue of FDCs.